Oh, and Elizabeth, if you could put the slide deck up too, that would be great, please. Welcome, everybody. I'm going to give folks a second or two to travel through cyberspace here. Perfect, Elizabeth. That's perfectly in presentation mode, so thank you for that. All right, welcome everybody. I am Jamie Strauss-Clark, your facilitator. It's nice to see you, or at least see your names. This is the House Bill 1477 CRIS Crisis Response Improvement Strategy Steering Committee meeting. So we had our full CRIS committee meeting on Tuesday. This is the follow-up steering committee meeting where a subset of our CRIS committee, the ones who form the steering committee, are going to be deliberating and making some decisions today about how we finalize our progress report. So I will get to that momentarily. Before we do, I would like to just remind everybody about how we use this Zoom platform in our meetings together. So Elizabeth, you could advance the slide, please. All right, as a reminder, I have two sets of slides. The first one is for our steering committee members only. And then the second slide I'm going to show you is going to look a lot like this first one, but it is intended for our community members and guests today. So first off, steering committee members, if you could please keep your cameras on mute today, unless you're speaking, and that will just help us avoid background noise and distractions. Steering committee members, if it's available to you, if you could keep your video cameras on. I know we do have one steering committee member who is battling one of the nasty viruses that is circulating, so she is going to be participating with her camera off today. But if you can't keep your camera on today, everyone else, if you're feeling up for it, that just does really help with our engagement and facilitation. Okay, we use the raise your hand function to let me know that you want to ask a question or offer some feedback. And to find that, you click on that reactions button at the bottom of your screen. It pops up a window. So you can advance the button there, Elizabeth. Perfect. And you'll see a raise your hand button. If you're participating via phone, I think it's *9 that you hit to raise your hand. And of course, as I always say, you can also wave your hands and I will get the signal and call on you in the order in which I see it. Okay, that's the slide, please. If you would prefer to communicate with me via chat rather than orally, you can send a chat to me and I will intersperse relaying the chat, what I see in the chat, from steering committee members with your comments. And finally, if you want to see everybody on the steering committee at once, you can click that speaker view and switch it to gallery view up in the top right. All right, next slide is for our members of the public. This looks very similar, I know, but members of the public, if you could please keep your mics on mute the entire time. The exception is at the very end when we do public comment. If you have signed up for public comment, then you can turn off your mic, obviously, when you're giving comment. Also, I'm going to ask members of the public for the body of the meeting when I'm facilitating discussion with steering committee members, I'm going to ask you to keep your video cameras off. That just allows me to really focus on facilitating the discussion with our steering committee members. And again, same suggestion for you. If you'd like to see all of the steering committee members during the discussion, you can switch from speaker view to gallery view in the upper right. Final words of instruction here. We have 2 ASL interpreters joining us today. They will be switching off every 15 minutes. Amanda and Andrea, they are actually pinned, so you should see them on your screen, and they're here to provide ASL support for those folks who need it. All right, I think that is all of the housekeeping. So I'm going to quickly run through our objectives for today and our agenda, and then I am going to invite in lieu of our traditional welcome that one steering committee member usually gives, I'm going to invite our steering committee members, if they like, to offer just a few words today of welcome, maybe some reflection on all the work that's been done over the last year. If you have some thoughts about the coming year, just want to open the floor to all of our steering committee members today if you are interested in offering some words today. So we'll do that after I walk through our meeting objectives and our agenda. So today's meeting of objectives, the biggest and highest priority is to confirm next steps for finalizing the 2022 progress report to the governor and legislature. And the reason that's a really big priority is because it's due on December 30th. So we have lots of feedback to process from the CRIS Committee on Tuesday, and that's what we're going to focus most of our discussion on today. If there is time, we'd also really like to do a deeper dive into discussing reflections from the CRIS on the 2022 work and their feedback on 2023 work to come, and share how that feedback might be informing some of your perspectives on the year ahead. That's if we have time. If we run out of time because we're having to take more time on the report discussion, that is okay. We will make that a focus of our early conversations in the new year. So that feedback is not going anywhere. It is going to be something we discuss. It'll just be about when we do it. We'll confirm action items and next steps, and then we reserve the last 10 minutes for hearing public comment. As of now, I do not have anyone sign up to make public comment today. So if you would like to make a comment, community members, please send me a chat and let me know if you would like to make a comment, and we'll circle back at the end of the meeting. I will take you in the order in which I receive your chat request. Okay, so really quick, I'll walk you through the actual timing of everything. So once we finish our welcome introductions and this part of reviewing our meeting agenda, we will dive into our draft progress report discussions. Then, as I said, if we can get through all of that in time, we'll spend a little time on reflections on 2022 and 2023. At 1:45, we will move to action items and next steps. And then finally at 1:48, we will start our public comment period. All right, with that, I think we can stop the share here. And I do want to open the floor, as I promised, to our steering committee members, just to offer a few words of reflection. And Representative Orwell, since I know this is a particular area of expertise for you, would you mind if I picked on you first?
No, I'm happy to do so. And no, thank you. I'm glad we're taking a moment to kind of reflect. I mean, it's pretty incredible when you think of, all the pieces that really are starting to unfold in our state. And it really started with everyone coming together, trying to have the vision and values of what's grounding us as we move forward. I think that was really well highlighted in the report we'll talk about today. And I just know all the subcommittees and the meetings, and it's a lot, but I feel like, we have so much to be proud of. I think of the successful launch we had of 988, how we've really carved out and have the Native and Strong line we're all proud of. And there's a lot of discussion around the next steps. And I think the engagement and feedback from community leaders and people with lived experience is going to help us shape where we're headed. So I'm feeling very optimistic. A little stressed out. It's right before session, so the timing of these discussions could not be better. But I just want to say thank you to all of you for being here and all the work you've done, and how excited I am for the next steps. Thank you.
Thank you for kicking that off, Representative Orwell. Other steering committee members, anyone want to offer anything to add to what Representative Orwell shared? Dr. Snowden, thank you.
Thanks. I would second much of what Rep. Orwell said and what we heard at the full CRIS meeting about the work that's been done. I think I would center my comment around the process and the observation that I think if we look back to where we started, we are now, I think, having much more meaningful discussion and input from the stakeholders. I think the process has gone the way most of us would have expected, but I do want to point out that it's different. We're not having to have health management associates carry the bulk of the discussion of the meeting. The meetings now are organized, and we're getting the input from the stakeholders around the table. And I think that's a very good thing, and will serve us well as we continue to move into next year.
Thanks, Dr. Snowden. Bipasha.
Okay, so this might seem unrelated, but I was just listening to a podcast where they were talking about how the best parents say or do things at the outset right only 30% of the times. That blew me away. But what actually builds the strongest parent-child relationships is not the failure rate, it's acknowledging the successes, and more important, the repair that good parents do when they fail. One theory they said is that the mistakes that we make are actually the necessary soil for us to build strong relationships. if we can do the difficult work of respectfully and lovingly reconnecting and rebuilding. And as I was listening to this, it made me think that this applies to building systems too, to building the 988 crisis continuum in Washington. There's lots of good stuff that has happened. So that's the acknowledging the good parts. And for where the things have been difficult, I hope we can all try to mimic that good parent model and keep repairing and keep coming back to the table and doing more amazing stuff in 2023.
Pasha, you always have such words of wisdom, and I also really appreciate the grace you offer to us parents who fail quite a lot of the time.
I can tell you, I don't feel wise most of the time in life.
Okay, well, I appreciate your wisdom, and I appreciate you sharing that with us. Other steering committee members, any words you'd like to offer? Okay, well, I really, really appreciate. Oh, Amber.
Well, just, I got to find the actual hand to raise. It always takes me a minute. So, no, I don't have a lot different to say than what everyone else has said. I mean, I'm so appreciative of all the work that everyone has put in and the contributions that everyone makes to this process. As I think most folks know, I'm the policy advisor for the governor on behavioral health generally, of which 988 is a very significant piece. But I just want to reiterate how important that piece is to the overall continuum of care. And I just really appreciate the work that goes into thinking about folks who are coming into our system through our crisis system and how we're going to do a better job and move the system along in the way that it should. And so I just so appreciate everything that people contribute and the honest feedback that people are willing to give. I mean, that's also really critical to us being able to think about the system and move it forward, is that people need to give us that honest feedback. And so I so appreciate that. And I would be remiss if I didn't make a mention of maybe the biggest impact to my life on this, which was the addition of the 988 coordinator in the governor's office, Megan Celadonia, who is amazing. And we are so happy to have her here. And I would not be able to do this work without her. So I'm going to embarrass her for a half a second. But that's one of the things that I really reflect on and really enjoy having her part of the team. So thank you.
I have to say, I do miss facilitating in person, but one thing I love is having access to the reaction button. Those are nice. Michelle.
Well, like Amber said, I don't feel like I have a ton to add to the comments. I agree with everything said by the other steering committee members. But I just think if we stop and reflect on where we're at, we're off to an incredible start. And really to think that we have an easy way to have an entrance, and now it's live into crisis and behavioral health support is pretty incredible. I also really appreciated what Dr. Snowden said about just the level of engagement we have and the incredible ideas that came out of, and a lot of, a lot of consistency among them about some of the things we have to do next and where we still are yet to really dig into things. And I think that's really going to help drive our work for the next year as well. So I'm excited about that.
Thanks, Michelle. Any other comments from our steering committee? Okay. Thank you so much for sharing those words of reflection about 2022 and 2023. I just want to add that I envision that in the coming year, given what we heard on Tuesday from CRIS Committee members, we are, in addition to having a lot of work, there's going to have to be some really candid and maybe sometimes challenging conversations that we're going to have both in CRIS Committee meetings and these steering committees. And I am observing, in addition to what Dr. Stone said about the level of engagement, some strengthening of relationships over this past year that I think is going to be a really important foundation for having this conversation. So that's what I'm imagining coming in the coming year and really appreciating. With that, I would like to turn it over. Well, actually, I would like to set up our discussion on the draft progress report, and then I'm going to turn it over to Betsy Jones to walk you through the synthesis of the feedback that we heard on Tuesday from the CRIS Committee and received from them yesterday in writing. So I will start by saying that Nicola and Betsy spent the last 2.5 days processing all of the feedback that we heard and synthesizing it, and really categorizing feedback that's directly related to revising and updating the report to be turned in on December 30th, and the feedback that's really related to thinking about how we prioritize and basically choreograph our work going into 2023. Today, or in this discussion, our objective is really focused on getting your direction, and our hope is to get conditional approval to make our recommended changes to finalize the report and turn it in on December 30th. That doesn't mean we're not going to tackle the feedback on the work of 2023. Again, it just means that that's going to happen after we get through this report, just because that deadline is pressing. So another piece of context I want to offer is we also received some really helpful, catches like line edits, or this phrasing sounds confusing, or these numbers don't match. And those kinds of edits, and Betsy will say a little more about this, but those kinds of edits, we are planning to just go ahead and make, I say we, but I mean Nicola and Betsy, they're going to just go ahead and make those edits directly to the report. That's not something we're going to use your time here to get approval on, because we don't see that as the best use of your time. The best use of your time we see is on discussing the higher level synthesis of the feedback and how we are recommending addressing it in the report. So again, our objective for this conversation is to get to a place where we get your conditional approval to make these recommended changes and finalize and submit the report. I will be taking a vote at the end of this conversation to confirm that formally. Our non-voting members, be Pasha and Dr. Snowden, even though you do not have a vote, your perspective on this is essential. So I'm going to be checking in with you also to make sure that we're hearing from you and your feedback is incorporated into the conversation. So please do speak up if there are questions or concerns or alternative perspectives that you want to share. And with that, I would like to turn it over. I'm sorry, I apologize. One final thing. All of the CRIS committee feedback is documented, and it's going to be included in the appendix of the report that's submitted. So that is going to be the record to confirm that we did hear from all of our CRIS committee members and have considered all of that feedback. So that's an important consideration. And now I'm going to turn it over to Betsy, who's going to walk you through the synthesis of the feedback so that we can have a discussion. Betsy.
Thank you, Jamie. Hello, everyone. Good afternoon. I'm Betsy Jones with Health Management Associates, and I am leading the effort on behalf of Health Management Associates and the BHI, Behavioral Health Institute, to facilitate this process and to make progress towards our ultimate goals for the 1477, 988 and crisis system redesign. And I want to reflect that this year has been challenging in a lot of ways. It's also been incredibly, I'm sorry, my dog is barking. The beauty of Zoom. It's been a great year in terms of building partnerships and helping us to improve this process as we go forward. And what I heard at the CRIS this week was just an incredible amount of support and enthusiasm for the work, both that's been done, but also that's ahead of us. And we had some really great comments that you'll hear about themes for the work ahead, as well as how to improve the 2022 progress report. And I want to, before I proceed, similar to what Amber said, I want to acknowledge Nicola Pinson, who is a project manager extraordinaire and has spent hundreds of hours making this report reflect the work that we've done. And without her hard work and talent, it wouldn't be where it is today, to the extent that, that people appreciate the report. Okay, so let's move into the slides. Okay, so we have synthesized in just a few slides the feedback that we received during the CRIS committee meeting 2 days ago. Overall, the report, what we heard was the report is a comprehensive reflection of work this year and sets up work for us in 2023. Also, very importantly, Washington tribes, through the tribal consultation that happened yesterday, expressed support for the report and the inclusive process that we engaged to develop it. We very much appreciated the tribe's partnership, and their feedback and recommendations and comments are reflected throughout the report. Major areas of comments received that will be addressed in the report are as follows. We want to ensure the clear message that the report does not yet reflect a complete picture of system needs and gaps. We're very clear that this report is a progress report, and that work is, we're moving forward with work in 2023 to improve upon the work that we've done. And language will be incorporated into the executive summary and the introduction to Section 2 progress updates, reflecting this point. Point number 2, we need to update and expand upon the data in the report, including a regional analysis of services available and access to services by population. The data in the report will be updated where it's available and accessible by December 23rd. We know that we won't get everything, but we're going to do our best to incorporate the data that we can update, and that's accessible, as I said, by December 23rd. We will also add statements to emphasize that the data is not yet comprehensive and that further work is needed to understand gaps by geography and population, including service maps by region. That was a point that was made by a number of CRIS members this week, that we look at work that's already been done and understand really regional services. And we'll review these topics in more detail in later slides. Number 3, there's an emphasis on topics for further work in 2023 in CRIS member comments. We're going to review these topics in more detail in later slides so that you can see thematically how the comments that CRIS members made about work in 2023 is aligned with our planned next steps for next year. Number 4, technical corrections to be integrated into the report and summarized for steering committee with a copy of the final report. So we are planning to make those technical corrections. Nicola is going to be going over the comments and addressing those technical corrections for the final report. And this includes comments relating to the accuracy or confusing language in the report. For example, the Department of Health has identified a correction to the cost estimate figures in Section 3 of the funding recommendations for the line tax, and those updates will be incorporated. And then finally, number 5, as Jamie mentioned, CRIS member written comments will be included as an appendix to the report. And we also provided CRIS members with a grace period through next Monday, which is, I believe, the 19th, to submit written comments that will be included in the appendix. Comments that were received by today were emailed to the steering committee this morning and are integrated into the summary of comments that we're presenting to you today.
Betsy, I apologize to interrupt your cadence here, but may I jump in? I have a steering committee member who would like to offer some additional comment here. Would it be okay to do it now, or would you rather we wait?
Sure, absolutely,
okay.
Please. Yeah.
Carrie, why don't you go ahead?
Thank you. I'm sorry, I was chatting behind the scenes. I wanted to make sure, again, as Jamie said, that I wasn't going to disrupt the flow, but I just wanted to offer, I think, a fine point to this particular slide, especially the Washington Tribes line, and just let folks know. Many of us from the steering committee had a chance to sit down with the tribes yesterday to do a formal consultation around this, and wanted to let folks know that the feedback, and again, I would love if we could invite some of the folks from the tribes to even offer this feedback on their own eventually, but what I heard was a huge thanks for the recognition that tribes are our partners in this, and that that consultation was really reflective of a lot of hard work of Healthcare Authority, Department of Health, HMA, BHI, UW, and finally our tribal partners, to really make it so that my feeling was tribes felt very heard and very respected through this process. And I just wanted to say a big thanks to HMA for ensuring that our Office of Tribal Affairs and Healthcare Authority, and the same for Department of Health, was listened to, and that all of those needs for us to ensure that we were partnering with our tribes were addressed. And so thank you very much for that. And wanted to just kind of echo how comprehensive this is, and the feedback that we were getting yesterday during that formal consultation. So thank you.
Thank you for those kind words, Carrie. It was a really great process to go through yesterday, and Lucy Mendoza of the Office of Tribal Affairs at HCA deserves a huge round of thanks, an amount of thanks as well. Okay, next slide then. All right, this is a little bit of the detail for you in terms of themes related to areas of work for 2023. So this is section 4 in our report, where we talk about the 4 big areas of work, the big buckets of work that we will be attending to as CRIS and steering committee members and subcommittees, and really wanting to let you all know that we are working hard to build agendas that focus deeply on these areas, so that our CRIS members, our CRIS committee, will have opportunity to really provide recommendations and feedback and understand what's happening in these areas, bringing forward state agency partners. We're planning together with HCA and DOH right now to make sure that we have the information about system goals and metrics, crisis system services, funding, and the system infrastructure to enable those conversations to happen. So we're learning from this first year really of digging in, building the foundation to have deep conversations next year. So CRIS member comments you'll see in that second column. These are the theme areas. They don't represent one person's comment. They're really about the themes that we heard related to these areas of work for 2023. So in the system goals and metrics area, we heard that we need an inventory of current data and metrics. We need to consider the variables impacting the ability to meet those goals and the goals and metrics that we set. And there needs to be a conversation about consequences for not meeting metrics. So what will that system oversight look like? What does data tell us about how we set goals and metrics? And that's very much aligned with the way that we are thinking about 2023. In terms of crisis system services, there's a request that we do a deeper analysis of data to understand system gaps by population and geography. For example, service maps by region, as I mentioned earlier, including co-response and first responder services and transportation. So those are gaps in terms of the information we have currently that we need to dig deeper into next year. We need to clarify roles and expectations for law enforcement. We need to clarify the relationship between 911 and 988. We need to focus on building on the existing system and adding best practices. So this was a request not to wholesale change the system, but to really take what we're doing well and build upon it, because we have a lot of best practices in our state. And to create an understanding of who is leading the system, and to understand the role of the BHASOs at the regional level as critical players in our crisis system services. In terms of funding, we need funding for 988 call centers to further diversity, equity, and inclusion efforts. A very specific call out to focus more deeply on equity. And then for system infrastructure, the recommendation that there be further discussion of geolocation and the implications for confidentiality, a recognition of the vibrant technology platform for future system design, an acknowledgement and a plea to continue to focus on workforce, and that workforce strategies will be critical going forward. There needs to be better understanding of current training for crisis response workers, and we need to continue to talk about system efficiencies between 988 and the RCLs, and the coordination between 911 and 988. And that's work that began this year with the cross-system subcommittee, and needs to continue as we think about what the future system will do and how it can be most efficient and efficacious. And then there was some feedback on our process and some recommendations about structural change that we are putting on a separate slide, because these really don't have to do with the report, the draft report that's in front of you today, but they're recommendations for going forward. There was a proposal to have a 988 subcommittee in 2023 to discuss geolocation specifically and the relationship to confidentiality, with a request that recommendations be brought back to the legislature in the 2024 session, and that the 988 call centers, behavioral health leaders and clinicians, and persons with lived experience and community leaders of communities of color be included in those conversations. There was a recommendation that we streamline subcommittees and perhaps organize them around the categories of the crisis services: 911 dispatch, 988 call centers, mobile crisis and co-response, emergency departments, and crisis triage and stabilization. There's also a recommendation that we have a newsletter, that we publish a newsletter about committee deliberations and state agency updates. And I believe that was related to taking less time at the CRIS for updates and having that information consumed in a different manner. And that more in-person meetings would be necessary to facilitate the dialogue and the relationship that will be needed as we move forward. And finally, to incorporate an extension of the timelines proposed by the legislation. Next slide, Nicola. Okay, so this is my last slide. This is just a little bit on our next steps. So as I mentioned, we've extended CRIS member written comments to next Monday, the 19th, not for changing this draft report that we're hoping to finalize, but to be included in the appendix so that we can incorporate as many written comments as possible. On the 21st, we'll send an updated report to the steering committee, and that's if we get conditional approval today. This is all pending conditional approval. We would send an updated report to the steering committee with changes incorporated by close of business, including a summary of changes made to address comments. So we're not suggesting that you all would have to read the report again and dig into each page to understand where the changes are. We will flag those changes for you and highlight them so you can see exactly how we incorporated the recommended changes and technical changes as well. And then the 23rd of December would be the deadline for any steering committee concerns on the updated draft, with the final draft shared with you all on the 28th and the submission to the legislature and the governor on December 30th on the due date. And that's what I have, Jamie.
Thanks, Betsy. Michelle, I can't remember, were you going to be adding anything? I recall that there was some.
Yeah, Betsy mentioned it. I can comment on that, though.
Okay.
I did send a few more comments from DOH on the section 3, the recommendations for expenditures for the behavioral health crisis system. I've had a few edits to just, I think, clarify what we were intending to communicate about, that we need more time with real experience of 988 being live and with a native and strong line to truly understand ongoing call estimates, and those ongoing call estimates, which the department is responsible for, but that really drives what portion of the tax revenue is needed for the call center. So as what was in there, we have some preliminary information and continue to try to refine our estimates, but it just really is too soon to know what that looks like, several years out. So that was kind of the basis of my comments. And we did make a correction to the amount to clarify, and it's my budget person was off last week and is back, but just to make sure it's clear when we're using numbers, which year the number we're using, because next year's number is lower than what our estimates are going forward. So just clarified a few pieces of that in that one portion of the report. So
Wonderful.
hopefully it's just minor technical and trying to even strengthen the message about that what we have as far as estimates are preliminary, and in the future, like the coming year, this time next year, we'll be in a much better place, I think, to understand call volume for the 988 call centers going forward.
Great, thank you for adding that context and clarification, Michelle. So Elizabeth, would you mind sharing the screen again and going back to slide number 7? I want to use that as the basis of our conversation. And just a reminder, steering committee, of what we want to confirm today. We are asking you for your conditional approval for us to address these 5 points that were raised by CRIS committee members in the ways that Betsy described. And I'll just go piece by piece here to remind you of what Betsy said, and then want to hear your clarifying questions, or if you have feedback or an alternative approach to propose, that's the time to have this conversation. So let's start with number 1. And I have my 2 screens on, so if you see me turning, it's not that I'm not paying attention to you, I'm just looking and reading my other screen here. So number 1 is ensure clear message that the report does not yet reflect a complete picture of systems, gaps, and needs. And the proposed approach here is to incorporate language into the executive summary and introduction to section 2 progress updates that is very clear about what this report is and what it isn't. So steering committee members, how do you feel about that approach? Does that sound right to you? Any concerns or questions? Carrie.
Thank you. I would say that makes sense to me. I think absolutely we need that clear message that says, hey, this is not, the end product that has all of the answers to it. I think that's great. I wanted to find out, in addition to that, I assume that language will also be strengthened that says, and I assume that because we've got it up at the very top bullet, but that also says, right, this will be addressed in 2023. And if we need to even further clarify some of those steps that we will take, that we may be primed to do that as well. So I just wanted to kind of say yes. And I think we can also strengthen up that commitment to making sure that this is addressed in 2023.
Okay, so to summarize the feedback, this language is good about clarifying what this report is and isn't, and strengthening our commitment to expanding our complete picture in 2023. So Betsy or Nicola, any clarifying kind of feedback there, or does that sound right to you?
That sounds absolutely right.
Okay, perfect. Representative Orwell.
Oh, thank you. I just want to clarify, are we at the window where you want us to share additional feedback that we kind of took away from CRIS and the comments, or is this mostly just pertaining to this slide?
I want to make sure I understand, Representative Orwell. Right now, we're going through the feedback we heard from CRIS committee members on the report and confirming that. If it's about 2023 work, I want to save that till later. But if you're talking about the report, I think this is a welcome time to offer it.
Yeah, no, it's pertaining to the report, and I thought
Okay.
that the summary one was very good. Thank you. It definitely picked up the main themes. And the one said in the report, and I saw several pieces that came to me, is clarifying that geolocation is 2 things. One is how the calls are routed instead of by area code to the location where the person is, which is something Vibrant plans to address next year, versus that geolocation, which is identifying where that person is to the 988 person, right? So I just want to make sure that the report kind of clarifies those 2 things, because I could see legislators getting kind of confused about that. But yeah, I thought the workup was really good. The other issue I haven't seen listed, which I think is going to be raised by legislator, is rural Washington. And I am a little concerned that there's not as much emphasis on maybe the uniqueness of it. talked to members of the CRIS that are just concerned about whether we're tailoring our responses to people that work in agriculture. So I think, again, that is something that might get raised in regards to the report.
Thanks, Representative Arbol. So I think I'm hearing two key messages here. One is making sure that it's very clear what geolocation means, and that there's two parts to it. And the second is if there's any way we can strengthen language around the uniqueness of rural Washington and how the approach as it starts to unfold in 2023 that's an area that's going to need specific approach and tailoring. So Betsy, any response there?
Yes, and Rep. Orwell, to your first point, that is a technical correction that we're going to be making. We're going to be looking at the report and making that technical correction. So you'll see a list when we send you the final report of technical corrections that we've made, and then you'll see exactly where we made those. So for your reading pleasure, to make sure that we get it right in that final report. And then in terms of the rural communities, we can strengthen our statement about the importance and the differences, as well as the work that we're planning for 2023 related to geography and population.
And thanks for raising that, Representative Orwell. I know that's a particular piece of particular importance to Representative Dent and Senator Warnock. So thank you for representing for them as well. Okay, any other feedback on this number one and the plan for how we address number one? Okay, I'm going to keep moving us through, but if you do think of something you want to respond to in number one, don't hesitate. We don't have to close the door on that. So number two, we heard a lot of this, need to update and expand upon the data that's in the report, including a regional analysis of services available and access to services by population. And the proposed way to address this particular set of comments in the report is the data in the report will be updated where available and accessible by 12/23. So the idea is to have the best available data in the report, as long as we can get it in there by 12/23. Statements will be also added to emphasize that the data is not yet comprehensive and further work is needed to understand the gaps by geography and population, including service maps by region, and a deeper analysis of the data will otherwise be incorporated into the work in 2023. So, steering committee members, how are you feeling about that? Does that sound right to you? Dr. Snowden?
I think it sounds right, but it's hard to know until I would know how much additional data we get. I think my anxiety about this is one of the places I think we have strength is in the input that we got from the CRIS on Tuesday. And so if we were to have totally new numbers in the report, and I know that's not going to be totally new, but just to give an example, if all the numbers were to be different, then we don't have the chance for full input from the CRIS about what would now be new numbers. And so part of me thinks that if it's a fairly minor increase in data, that'll be fine. But if it's going to be a major thing, I would actually favor us just calling out the limitations of the data we have and that we can improve it next time than to have something that makes this a totally different report potentially than the CRIS already saw and gave feedback on. Since we're putting all of their feedback in an appendix, it may now be completely out of context if the data is dramatically different from what they saw.
I see a lot of nodding heads to your comment, Dr. Snowden. So I'm guessing that is that your comment resonated with other steering committee members. So I think where I'm hearing the line is if any new data that we could incorporate into the report by December 23rd doesn't material or substantially change the picture, then it would be fine to incorporate it. But if it's really starting to change how we see current state, it would be important to note that this analysis is based on the data that was available or incorporated to a report earlier, and we will continue to update our picture as better and more complete data are available. Before Michelle, before we go to you, I just want to check in with steering committee members. I saw nodding heads, but does Dr. Snowden's proposal for how we handle this make sense to everyone? Anyone have any concerns about that? I see a thumbs up from Pasha, thumbs up from Carrie. Okay. Betsy, all good there? Any questions?
All good there. I think that's
Okay.
really wise counsel. And again, the purpose of the data is to help us look at what we're doing and where we're going next year. So we want it to be right, and we want to have it to direct us and to help us interpret our recommendations.
Okay, great. Michelle.
Yeah, that resonates with me. And I think it's probably better said than what I'm going to say here, but I think there's a piece where there was lots of conversation, which I think was pretty incredible yesterday, about the data, and especially understanding the gaps of who's not being served and what do we need to do to really tailor interventions by different factors and different populations. I mean, Representative Orwell just mentioned rural and agricultural. I think we've heard that from a lot of other groups. I do just I'm a little bit anxious about overpromising here too, though, because I think a piece of standardization in the data, especially for the call centers, is going to come with a new data system, which is farther out, and we have a lot of work there to do. So especially on who's calling 988 right now. So and so to me, that we have work to do as the Department of Health and the call centers to help level set what's actually available right now. We've got work to do with the call centers to talk about what more could we be doing without the existence of a standardized data system to pull some of these metrics out. But really, the ongoing plan about how are we going to consistently track data from who's calling 988 is about new technology, which is a much longer term plan as outlined in that technology plan. So I just want to make sure that's, I don't know how to add that, but I do think there's work to do to level set and think about what can be done now, but what may be part of the longer term future as well.
Thanks, Michelle. So I'm hearing you made a great opening there, which is we have to be careful not to overpromise. So improving the data collection is more of a long-term prospect. So we can anticipate having some better and more complete data in the coming year, but this is going to be more of an ongoing and long-term process of collecting data. And we want to make sure the language that we put in the report is very clear about that all of our dreams are not going to come true in the 2023 report as far as data is concerned. Am I hearing that right, Michelle?
Yeah, and it is that there is a connection between longer term data and the future and the technology plan.
Okay,
because
that's a great link to great link to
what metrics do we need to collect consistently. So there just is a piece there. I mean, there's a connection between those two things.
Okay, so Betsy, is that do you need to?
Yeah, I really appreciate that feedback, Michelle. It's very important to have just a realistic picture of where we're going, right? We can make improvements, and improvements are they happen over time too. And the accurate data and that system to collect standardized data is going to be really important to have in place.
Thanks, Michelle. Thanks, Betsy. Carrie, I saw your hand pop up there for a second. Did you change your mind?
No, well, it was just that agreement. Really good point, Michelle, that we've got that tech ops plan that stands alone, quote unquote, but does not, and maybe a nod to that as we're really talking about the data that's available versus what we hope we will be able to gather in the future with some of the tech ops plan. I think really that is important. I'm glad, Michelle, that you brought that up. Thanks.
Cool. All right, anything else here on the data piece? Okay, again, if a question or a new thought comes up for you as we proceed through this discussion, please don't hesitate to take us back. That is totally fine. Okay, number 3, a lot of emphasis on topics for further work in 2023, and the proposed remedy there is the section of the report that talks about the work for 2023 will be expanded in terms of adding a few additional things, but it's still going to stay at the higher level. Betsy, please correct me if I have this wrong, but it's still going to stay at the higher level. It's not going to get into the deep dive of details. That's anything to add there?
No, that's right, Jamie. We're
Yeah.
going to be including themes that we've heard from CRIS members in their comments. And so I think that that's an important additional piece to add with the plans for 2023 to say in these areas as specifically requested by CRIS members, in addition to other work that we'll be doing.
Okay, so steering committee members, does that work for you? Any concerns or questions there? Dr. Snowden?
In general, I think it works. One of the themes that came up pretty clearly on Tuesday is that we have to acknowledge the regional way our system is set up and the regional direction that plays. And I think we should be as explicit about that as we can. The caveat, though, is that I think we still need to address and understand that part of our issue is regional variation and difference. And so staying with a regional leadership model won't necessarily address the fact that there may be disparities from one region to another, and that's potentially a weakness of a system that's totally based on regional leadership.
Okay, so I'm hearing Dr. Snowden, a need to make sure that we are addressing the bulk of feedback, a lot of feedback we heard about the regional nature of the system, while also acknowledging the limitations in terms of potential disparities. So, Betsy, okay, great.
Second thing, if I could just add one more thing, and I'll be finished with this, is to the extent that we have the issues with the numbers of the calls and the importance of that in terms of the expenditures and the importance of that with regards to how much money is left for other parts of the system, I think we do need to call out more explicitly what the marketing plan will be so that we know when to expect the best data on call volumes and the increase so that we have a refinement in how much are we really going to be spending on calls and how much will be left for other parts of the system.
Okay, I want to make sure I'm tracking that. So acknowledging that in order to collect data on call volume and have a better understanding of who's calling and how many folks are calling, we also need to understand what the communications plan is and the timing of that so that we know when we can expect to have more of a normalized level of calls. Okay. Betsy, any questions there? Does that sound right to you? Okay, great. Thank you, Dr. Snowden. Carrie and then Representative Orwell.
Thank you. I think love the feedback, Dr. Snowden, and couldn't agree with you more, except a friendly amendment that regionally speaking, I think we can also capitalize on that there are very strong successes that can be pointed to with a regional approach of tailoring and specifying the services for that particular region's needs and ensuring that there isn't duplication or underserving. And so to the extent that we can talk about the differences of standardization statewide versus tailoring things to a regional model, which is statutorily mandated in Washington state. I think we want to do that balance and really make sure that we are giving credit to the holistic view statewide, as well as especially giving, I think, acknowledgement and support to our frontier and rural regions, acknowledging that consistency, yes, but specialization, yes.
Okay, so the amendment to the proposed, I'm not even sure if it's an amendment necessarily, but maybe an expansion of what Dr. Snowden said, which is that the regional model we can aspire to a place where we are getting both tailoring and consistency and equity statewide. Okay, great. Before I go to Representative Orwell, Dr. Snowden, any response to that? Does that sound right to you? Okay, great. Representative Orwell.
Yeah, no, I strongly support this conversation. Senator Dingler and I, we kept the fee at the state level to make sure all areas of the state got the resources they needed. But I also think we've heard and from the feedback, the PHASOs have a lot of value to add. And we saw that in Arizona with the REBAs that we all were very impressed in, that when there was the regional piece, that it really strengthened the system. So trying to find that balance will be important. I also, in this 2023 session, this is our biennium, we will be making decisions on the fee this session. So I think it's going to be very important to understand the projections of the call volume, and not that it's going to be perfect, but I think we can all think once there's a national marketing and we're doing more marketing at the state, that the volume will go up as we have those protocols with 911 and maybe do some closer work, that those call volumes will go up. And so I know it's not easy, but this kind of is our year to try to figure out those pieces.
I did it. I talked over my mute button. Thank you, Representative Orwell. Okay, any other comments on the work in 2023 before we move forward? Dr. Snowden.
Yeah, if I could add one more thing, then it seemed to me on Tuesday, we heard several people say that in addition to this notion of creating metrics, we have to explicitly create goals for what the right number of different types of services is. And so I think at some point calling out that metrics may not be the same as creating concrete targets and goals for capacity.
Okay, so I'm hearing draw a distinction between metrics and targets, so that's also really clear for the reader. So Betsy, before I move us on, any questions that we need to probe further from the feedback we've heard from Dr. Snowden and Carrie and Representative Orwell on this particular topic?
No, I understand all the comments.
Okay, so we can address them. Great, wonderful. So moving on then, number 4, technical corrections to be integrated into the report and summarized for the steering committee with a copy of the final report. I think that one should be an easy one for us to dispense of, but just a reminder, the technical corrections that have been provided by CRIS committee members, agencies, the tribes, those are going to just be addressed and incorporated into the report and summarized in the appendix. I think that includes the technical correction that Representative Orwell raised earlier about geolocation. So any additional feedback here before I move on to number 5?
Jamie, I want to ask Nicola, I don't believe we're summarizing that we're adding them to the appendix. We're actually sending the technical corrections out to the steering committee. So
my apologies.
Yeah. Yeah, we will change the report to reflect. Yes.
Got it. Thank you. Thanks for clarifying that. All right. Oh, Michelle.
Oh, and just one quick thing for everybody to know, there was a mention from a couple members yesterday about the impact of the pandemic on behavioral health. And I did make sure Nicola and Betsy know about the behavioral health reports and for the pandemic that the department has been producing. So they're broken back down for youth and for adults. So that may address some of the data that was asked for in that aspect.
Excellent. Thanks for that, Michelle. So then the last one is CRIS member written comments will be included as an appendix to the report. And those are comments we received as of December 19th, Monday. Is that right, Betsy? Okay. So stepping back and looking at the body of both the summary of the feedback we received from the CRIS and how HMA is proposing to address that in this revision of the report. Just a couple more quick questions for you. First of all, anything that we missed here that you feel like still needs to be addressed? Anything you heard Tuesday? Representative Orwell.
Well, I just want to say this one. I think the last couple meetings have been very interactive with the group, and I feel like there's been a positive feedback. And again, I think, we just want to encourage moving forward that we kind of keep that atmosphere where people feel safe to make comments. They feel like they're part of the process. So I want to say I think it's gone really well the last 2 meetings. It feels like we're headed in the right direction, and just thank everyone for staying engaged, because I also know Zoom is very difficult. So I'm really looking forward to those in-person meetings. I think that's going to help too.
Thanks for raising that, Representative Orwell. And yeah, I could tell CRIS members really appreciated having time to dialogue with each other about the November meeting and Tuesday. So I echo that as your facilitator. Any other feedback? Anything that you feel like we might have missed here that you want to make sure we talk about? Okay, so my next step then is to ask for your conditional approval for HMA to make the changes that we discussed today, and then prepare to submit the report by December 30th. So before I take your vote, just want to check in, since Bipasha and Dr. Snowden aren't able to show you by vote how they feel. Dr. Snowden, what would you advise the voting members to do here?
I'm fully supportive of the conditional approval.
Okay, great, thank you. And Bipasha?
Yes, what Dr. Snowden said.
Okay, great. Thank you for that. And thank you everyone for your thoughtful questions. So steering committee members, I'm just going to ask you, you can click raise your hand, or you can just raise your hand. Do you provide us with conditional approval to make these changes as discussed? Looks like I see 3 hands there. 4. Great, I think that's it. Good, wonderful. Thank you so much. Appreciate that. And it looks like we have some time to do a little reflecting. So I appreciate us getting through that. I really appreciate all the work that Nicola and Betsy did to synthesize the feedback. I think that made this a really clear, productive discussion. So thank you for that. So we also on Tuesday got to have a lot of discussion about reflections from the CRIS Committee on 2022, so looking behind, and then looking forward, what they hope to see in 2023 and how they hope to contribute. And I wanted to give us a little time as the steering committee to process that together. And this is, I think, the first of many of these conversations, but just give some thought to how what we heard on Tuesday might influence our thinking about how we prioritize and sequence the work going into 2023. So I have 2 questions to seed our discussion. The first question is, when you reflect on how the committee met expectations for 2022 and what remains to be addressed, what stood out for you and why? So just thinking back to what you heard in Tuesday's discussion, what stood out for you and why? And then the second question I would like to hear from you on is, what are your initial thoughts, and I emphasize the word initial here, about how we might adapt our approach in 2023 to set ourselves up for success? And I think Representative Orwell nicely kicked us off with that last comment about how she detected a positive vibe, I guess. We didn't use quite these words, but a positive vibe from the opportunity to have more time for discussion in CRIS committee meetings at the last 2 meetings. And so I think that's the kind of thinking that we're all doing about how we might move forward in 2023. So what stood out for you in Tuesday's discussion about 2022 and what's coming? And what are your initial thoughts about how we might adopt our approach moving forward based on that feedback? And please feel free to take a minute or 2 for some silent processing if you need to, and then raise your hand or send me a chat if you have thoughts. Wonderful. Start with Carrie and then we'll go to Bipasha.
Thank you, Bipasha. I promise I won't be as long-winded as I normally am. I think the one thing that really stood out to me is, and we hear a variety of this, but is kind of who's doing what, who's in charge, and just an acknowledgement that the behavioral health system, the community behavioral health system, and the behavioral health system, kind of the larger, is really complicated. And I think it is, we ask a lot of our CRIS members to really understand every single piece of the component. And that's a really difficult ask. Coming from the seat of the Director of Behavioral Health for the state of Washington, I need cheat sheets along the way to remember every single thing that we do and why we do it. And if it's statutorily driven or if it's a policy. And so I'm thinking what I heard in my own mind was it would be great to offer CRIS kind of a 101 of the behavioral health system, where we were, where we are, and where we're going from I think right now, because there's so many sibling agencies involved, really from the executive branch kind of point of view. So I would just kind of throw that out there as something that I'm curious as to if folks think that might be useful, especially folks who are not from agency land. So I'll pause there.
So that's a really interesting suggestion, kind of a education or a primer on the systems and the players and how things are done. That's really tailored toward, well, all of us, not, because it sounds like, Carrie, you're saying even in your role that it can be hard to peel this onion and understand all the layers. Okay. That's such an interesting and great thought. We'll make note of that. Be Pasha and then Representative Orwell.
Harry, you can talk. I like listening to you talk. And yes, where can I sign up for what you just suggested? It would be deeply helpful to someone like me who doesn't work in any aspect of government, really. And I think a lot of people on the CRIS my opinion, would appreciate that sort of, just like a schematic on this is how things work. And it would be very helpful. I think it would be helpful in the work we do next year. In kind of saying, oh, this is where I can really contribute, or this is where what I know will make a difference in sharing. So thank you. About the meeting on Tuesday, I thought that normally we've had breakout rooms and we did this time, but I think the collective discussion was very helpful to me because I could hear everyone's feedback at the same time. And I would invite more, just where all of us are together, having those discussions. And yes, if the viruses that allow us to meet in person, and I know it's hard because it's a cross-state issue and people are, in different parts. I don't know how that could be addressed, but if we could do in person and synthesize it with, Zoom for those who can't make it that day, there's nothing like meeting in person that can help us iron things out and look into people's eyes. So I would strongly, support that, because that's what Rep. Orwell also mentioned. So thank you.
That's both excellent points. I've actually been facilitating a lot of hybrid meetings lately where some of us are in a room and there are some folks on the screen. So it takes some new approaches, but it is possible. And Bipasha, I appreciate that feedback. I've heard a lot of people say they like the breakouts because it gives them more time to have voice. And then I did notice that it was also really nice to have some group time. So it sounds like we could strike a balance there that gives us a lot of different opportunities to engage with one another. So thanks for raising that. Representative Orwell and then Senator Dingra. Representative Orwell.
Yes, some of the things I heard a theme over and over was we actually would like a deeper dive. So not that everyone doesn't need to see the big picture, but I also heard that a lot of people really wanted to go into greater detail. And so, finding that balance, I think we have, a system which we all know could be doing better. It often calls trauma, it's complex, it's fragmented, and we need a 5-page paper to describe it. And so, certainly I think people are hoping we're heading in a direction that the system will be more accessible. And I always think of Joseph Campbell, who said, bureaucracies can be soul crushing. And this is hard work. It's hard work if you work in agencies, you're trying to work with agencies, just because these are systems, right? And we're all people and we care about people, but we have to work within these systems. And so I think there's this recognition it's difficult work. And sometimes it feels like you're moving a tanker, and it's not that everyone's not part of the process. It's very difficult work. And so I felt very energized the last 2 meetings, and I think the feedback is that we're moving in the right direction. So.
Indeed, and I heard a lot of the same things you did, Representative Orwell, in particular, going deeper on the data and understanding the data at a more disaggregated level. I heard that as well. And I also just wanted to add, in response, Carrie, to your suggestion about a behavioral health 101, I do have a comment here from a community member who's observing today, asking if that could be made available to community members. So it sounds like there's widespread interest in getting this behavioral health 101 training. So thank you for that. Senator Dingra, and I'm sorry you're still feeling crummy.
Thank you. I'm feeling better than I was on Tuesday. I couldn't stay for the entire meeting because I faded very quickly. So I'm sorry I couldn't hear all the comments, but I just wanted to take a moment to reflect on actually something what you said, Bipasha, about parenting and the podcast you're listening to, and thinking about how we started, what the intent was, and where we are today. And I really do think that we tried to do something different in setting up the structure of CRIS and the subcommittees to try to really be as inclusive as possible. And I have actually really enjoyed the journey of hearing the feedback on how that's going and trying to make adjustments along the way. And I do feel we have made adjustments along the way. And I am very optimistic in seeing how we can actually replicate the structure for other task groups, because I do think this has been a much more inclusive process than other government task forces that I've been involved in. I know the CRIS Committee tried to do something similar, but I do think that this work has pulled it off better than any other task forces that I have seen. Maybe not the poverty reduction task force, that one is exceptional. But anyways, I just want to reflect on that because I do think we've taken those corrective measures. And the other thing I will say is that even though in the beginning it felt that we were being talked to a lot at these meetings, I do think that helped us level the knowledge base that we all came to and kind of made sure we were all operating from having similar understandings of structure. And so for me to see our last few meetings where there have been so much more interactive, sorry about that, and participatory, I really think we got there because of the process. So in 2023, I'm looking forward to continuing to improve on the process, and I'm looking forward to having a lot more engagement and that depth of conversations, because I do think we've built that infrastructure to be able to get us there. So I just want to take another moment to thank every single person for just showing up, participating, reading that full document, and providing comments. The only other thing I'll mention is I am aging and getting older. So if everyone can start using bigger fonts on their emails, that would be greatly appreciated. But thank you all so much for everything that's happened this entire year on CRIS and the steering committee and the subcommittees.
I'm with you on the font size, Senator Dingra, but I also wanted to reflect on a few things that you said there. First, about the process of 2022. I think we've been hearing a lot or thinking a lot about how it really was foundational. I think Betsy used those words, that it was foundational and got us to this place where we can have more dialogue and deliberation. Betsy also mentioned some suggestions that can help us continue to preserve the time that we have together as the CRIS for more dialogue and less reporting out. I think Betsy mentioned the idea of having a newsletter that captures, because it is very important to CRIS committee members to be hearing from Michelle and Carrie and others about the work that's happening between CRIS committee meetings, but maybe there are some tools that we can continue to use more so that they can get that in ways other than report outs in the meeting. So thank you for your reflections there, and I hope you continue to be on the mend. Dr. Snowden and then Michelle.
Thanks. I like the idea of Behavioral Health 101, especially if it can address what I heard a lot of people on Tuesday saying is wanting to know who's actually orchestrating the process. That's a theme that I heard sort of over and over, and I think it's complicated, so there may not be a single person, but the more we can get explicit about who's responsible for certain aspects, I think that will address this underlying theme that I heard. The other comment I would make is I do believe that going forward, we will have to do a slight pivot, because from a process standpoint, this is a complicated enough system that we could spend all of next year just trying to understand it in its entirety. Whereas I see our charge at the end of the day, at some point, we've got to say we understand it enough to make recommendations for improving it. And if we spend too much time trying to have a thorough understanding of every little thing, we may fall short of getting to the point where we start making recommendations on how to change it.
Favorite phrase we use in my house is "Don't let perfect be the enemy of good." So thank you, Dr. Snowden, for that caution for us, or reminder for us. Michelle.
Yeah, I was just going to comment on the idea of how do we prep some updates in writing, and if that and a newsletter idea, or however we want to look at that. But in another advisory committee the department runs, we do that, and then just cover a couple quick highlights and give time for questions in the meeting if we get out that information ahead of time. So something we could consider, and actually fits with some stakeholder feedback I've gotten about people just tracking all the moving pieces that are happening. I also wanted to comment that I do think the discussion this week, I don't remember what day it was, also highlighted that there continue to be some pretty significant differences and tensions between how people see different pieces of the system and how it needs to go forward. And I think the 988, 911 geolocation role of co-responder teams is because I think we've heard feedback that is directly contradicting to each other by some stakeholders at the CRIS. So I appreciate Representative Orwell's suggestion about how do we really dig into that and be clear, and how do we keep everybody at the table, because there is comprehensive roles for everybody, but clearly we need to do a lot to really dig in there and really help think about what is gonna, like, really what are the gaps. And I know this, I said already, there's a lot of challenges to truly understanding who's not being served that we have within our data and others, but like what's gonna help people use the resources we have, and making sure the system really addresses where the gaps are is just something I've been thinking a lot about lately. And just there's a lot of work to do, I think we have together to understand that and really have some deep conversations about where some of these points of tension are, about how we move forward.
Yeah, Michelle, I heard a lot of the same things you did, and that, you know, we will need to have some potentially difficult conversations where people are coming at it from very different perspectives. And as I mentioned early in our meeting today, I'm feeling like we're getting to a place where the relationships and the trust in each other is strong enough to start really having some of those tricky conversations. So thank you for raising that. Carrie.
Yeah, I would just say to kind of, I think, piggyback off of Michelle's comment, there's research that exists that I would encourage us as the steering committee and to bring to the CRIS about the use of certain interventions in certain situations. You know, co-responders and mobile crisis response teams are not just a Washington state specific thing. They are nationally recognized. And so I think we need to point to research. And yes, there's difference of opinions, and oftentimes it might be nice for us to have research to help us make those decisions, as opposed to kind of thinking that these are opinion-based things. I'm going to say research one more time. It exists. SAMHSA drives the work that we do for behavioral health. And there are numerous articles, I think, that we should be pulling to provide to the CRIS committee around measurements that already exist around best practices and around interventions that are appropriate for different stages in the crisis continuum.
So in thinking about how that informs our approach for 2023, Carrie, I'm hearing that the research exists and we can do more curating that and sharing it with CRIS Committee members so we can have informed discussions and start to tackle these things from a place not just of opinion, but also of best practices. So Representative Orwell.
Well, on the note of best practices, you know, I could not recommend enough to my fellow steering committee members and Chris and the folks here to really consider adding the 988 jam to your weekly Wednesday mornings. And, you know, they really are highlighting national best practices. I know last week's was around serving people that have intellectual and developmental disabilities within crisis systems, and they're really highlighting some great work. And so it will help us in our research, which I really appreciate, that we could be looking at best practices. So thank you for bringing that up.
I have heard a lot of good things about the 988 crisis jam, so thanks for mentioning that. I also want to mention that Pasha shared in a chat that that she can validate or verify that folks on the lived experience subcommittee would also really appreciate the behavioral health 101. So I think just universal appreciation for that opportunity. And I think that sounds like something we should definitely explore in 2023. Other reflections from our steering committee? Oh, and a reminder from one of our community members that the 90-day crisis jam is also recorded. So if you can't make it Wednesday morning, you can look at a recording. So thank you for that, Luke. Well, I really appreciate this time to process with all of you. I think we'll, like I said, I emphasized the word initial. I think we'll need to continue this conversation into the new year. But it is really nice, especially at the end of the year, which is a symbolic time as well, to reflect and process together. And I'm grateful for this time with all of you. We are way ahead of schedule, and I do not have anyone signed up for public comment. So I might give you a holiday gift of a little extra time in your day. But before we go, let's just do some quick action items and next steps. Betsy or Nicola, can you remind everyone, I know you went through it before already, but just a quick reminder before we go of the next steps for the report.
Nicola, you want to go?
Sure. So I think as we reviewed on the slide, we first have the extension of the time frame for CRIS members to offer written comment by Monday, the 19th. We'll then send an updated report to the steering committee with the changes incorporated and a summary of the changes made to address comments by Wednesday, the 21st. And then we are seeking any concerns from the steering committee by the 23rd so that we can finalize the report and submit by the 30th.
Thanks, Nicola. So any questions from the steering committee about that timeline? Okay. Well, I just want to say an extra note of appreciation for all of you. It has been a tremendous amount of work for all of you this year, and I've really, it's been a privilege to work with you this year, and I look forward to a very productive 2023, and wishing you all, oh, wait, before I go, Pasha.
I just want to say thank you to you, Jamie. You hold the space so well, and you know, it's always amazes me. So thank you so much for doing what you do.
No, it's very kind words. Thank you, Pasha. Pasha is very good to me. Wishing you all wonderful, healthy holiday season, and healthy and safe, and a very happy new year. And I will look forward to seeing you in 2023. Thank you, everyone.
Thank you so much.
Thank you.